Hello, I'm Dr. Tara Bishop, the Chief Clinical Officer at Bind, a health insurance company that aligns coverage with value and offers price certainty for our members. In my role at Bind, my team and I work to make sure our members have access to affordable, high quality healthcare. One of the areas that we have seen a spike in recently is virtual care, and particularly virtual mental health care. Today, I have the opportunity to chat with Dr. Nikole Benders-Hadi about these topics. Dr. Benders-Hadi is a medical director of behavioral health with Doctor on Demand, where she oversees their virtual behavioral health offering. Dr. Benders-Hadi has done research and writing on women's mental health issues and has held multiple positions with the New York State Psychiatric Hospital System, including directorship of the Clubhouse Recovery Program, as well as director of outpatient services and chief of psychiatry roles. She is a board-certified psychiatrist who completed her undergraduate degree at Johns Hopkins University and attended medical school and residency training at New York University. She completed her fellowship in public psychiatry at Columbia University. Dr. Benders-Hadi has spent her entire career working hard to improve access to high-quality mental health care. Dr. Benders-Hadi, we are thrilled to speak with you on these two very timely and important topics, virtual care and mental health care. Before we get started, can you clarify for our audience the difference between virtual care, virtual visit, telehealth, telemedicine, teletherapy, and e-visits? Are they all the same or just different labels?
Thanks, Tara. Thanks for having me. Yeah, there really are a lot of different terms out there these days. I think that's really just a function of how rapidly this new care delivery model is expanding. In terms of telemedicine specifically, I like to think of that as just remote clinical care. Same with teletherapy, remote therapy services. Absolutely the standards for quality of care are the same. It's just a different delivery model, it being virtually or not in the same room with the patient. I do like to think of any virtual care terms as being a bit broader, since it can encompass a variety of other digital tools that you can use to deliver healthcare, whether that's with video visits, audio only, text or instant message services, collecting of data from wearable devices, sharing electronic documents with a patient or homework assignments. So the virtual care model I like to think of as a bit more broad, but it is most important just to understand the specific services that are being delivered so you're speaking the same language between the healthcare system and the patient. Ultimately, it's all about breaking down those barriers to access to care so that patients can get the care that they need faster.
Thank you very much. That was helpful. And I know it's a confusing set of terms and terminology. Let's deep dive a little bit more into this concept of virtual care. As a medical professional, what health benefits do you see virtual care presents, and what encourages you most about that care?
Access for sure rises to the top of the list. I absolutely have seen patients in remote areas tell me about the lack of access to mental health services for them in their communities. But the same is true for urban areas, that there can be months long waiting lists to get in person care. With psychiatry in particular, we know that delays in treatment can often lead to worsening symptoms and poorer outcomes. Also relevant here is the issue of mental health stigma. Even though I think we've made a lot of progress in terms of combating stigma, it certainly does still exist. And there's still a lot of patients out there who are simply more comfortable accessing care virtually, where they can do so from the comfort of their home. So when patients are more comfortable, particularly in dealing with sensitive uh, mental health topics, they're going to be more open and able to achieve better health outcomes.
Thank you for that insight. When you think about the healthcare industry in general, there has been some hesitation among providers and insurers to rely on telehealth for care or even to pay for telehealth for care. And yet the popularity of virtual care has continued to grow. And COVID-19 as a pandemic has proven that that virtual care is almost a critical need and service to support social distancing and shelter in place orders. What do you see about the future of virtual care? Do you see that need and that demand easing up after COVID-19, or do you think that this shift is here to stay?
I sure hope it's here to stay. I certainly can understand, some of the hesitation that you'd mentioned. Largely, that is related to concerns about things like the stability of the tech platform that you're using, privacy issues, questions or concerns about the types of patients or the types of conditions that can be treated virtually, but really being able to deliver high quality clinical care in a way that's faster and more efficient, in my opinion, that really aligns perfectly with what we call the quadruple aim of medicine, right? So, enhancing the patient experiencing, improving population health, reducing costs, and improving the work life balance of healthcare providers, right? Being able to work in a setting where it's easier for the provider, especially again in mental health care. That's going to result in better care for the patient that they're seeing on the other end as well.
Yes, and it resonates, I think, with much of what we're hearing in the industry, that this has been a big change that will likely last longer and beyond the pandemic. I'd love to hear a little bit about Doctor on Demand and what you're doing at Doctor on Demand, given that COVID-19 has obviously led to more potential mental health issues because of isolation and stress of the entire pandemic. And the need for mental health care and the demand for mental health care has increased. This can be, we know this is an area that is difficult to navigate, and we know about workforce shortages in this area. How is Doctor on Demand addressing the increased demand for this kind of care and the workforce shortages that do exist?
Yeah, the great question. At Doctor on Demand, we certainly have seen record visit volumes since this pandemic began. What I think is interesting is that, we very clearly started with a spike in our medical and urgent care visits, people expressing concern or having questions about physical symptoms they were experiencing, flu like symptoms they were experiencing, and wondering about what this COVID-19 virus actually is, whether they have it, how they can get tested. There was a bit of a delay in our spike in behavioral health visits, but we certainly have been seeing record visit volumes. As numbers are starting to come down some in terms of infection rates, those medical visits with our company have began to come down back to normal or expected levels, but our behavioral health visits have remained high. I think we're seeing a lot of increases in reported symptoms of depression, anxiety, trauma reactions. I also strongly suspect there's an increase in things like substance abuse disorders we're seeing, although historically, things like reports of alcohol and drug use are underreported. Luckily, we've been able to keep up with the demand. We also have an integrated practice where our medical and behavioral health providers are working together. We have cross-trained our medical providers to be able to treat things like mild to moderate depression and anxiety symptoms, and are able to see patients even on demand. We also have been able to leverage the fact that many of our providers may also be working in separate environments, a separate private practice that's brick and mortar. And if they have been unable to continue seeing patients in person in those brick and mortar settings, that we've been able to add on additional capacity for our virtual visits in that way as well.
That's interesting. And are you seeing a lot of clinical benefit of serving the mental health needs through virtual care? What are the clinical things that you're seeing come out of the access to this kind of care?
Yeah, so we absolutely are able to reach more patients, right? Meet those needs more quickly, as I was saying before. But there's also a lot of clinical benefits that, particularly for mental health conditions, um, you can be better set up for with virtual care delivery. Take, for example, a patient who has some social anxiety symptoms or agoraphobia, a fear of open spaces. The ability for that patient to actually step outside their home, go for a walk down the street with their therapist in the palm of their hand to do real coaching in real time with them is resulting in us seeing better outcomes and faster results for our patients. I think also being able to gather additional information on things like social determinants of health, right? Being able to see into a patient's home environment, to be able to ask them to walk over to their fridge, take a look at the kind of diet that they have, get a sense of that, to get a view of the physical space within which they're living, to ask them to pull a family member into the visit to talk about how to better support that patient. These are all things that we, as physicians are doing and asking about on a regular basis, but to be able to do it in real time virtually just makes that process even easier.
Wow, I had never thought about the concept of walking down the street with a patient with a doctor in the palm of their hands. That's fascinating. Thanks for sharing that example. Um, I'd love to also hear about some of the challenges that you may be facing. Do you guys face any barriers such as prescribing medications or performing diagnostic tests that still exist and limit the greater adoption or ability to serve patients virtually? And how is Doctor on Demand addressing those issues?
Great question. So, um, first is clear is the controlled substance issue that remains limited. Even though with the current pandemic, we've seen some movement and things like a waiver of the federal mandate that requires patients to be seen in person prior to being prescribed controlled substances like opiate medications, benzos, stimulants. That has been waived during the emergency at a federal level, but still remains in place at the state level. So that's remains a barrier for us as a company. I think it has forced us to lean even more heavily into our collaborative care model, where we're working with brick and mortar facilities, a patient's primary care doctor that may be in their community to assist with those types of things. I also think, you have to take consideration of some types of medical conditions that cannot be treated virtually, right? The ability to really get a view into a patient's ear, for example, to diagnose an ear infection is not something that we're able to do. Within a behavioral health population, some psychotic patients may have limited insight into the need for treatment. But again, it forces us to lean more into our care coordination, where we're doing more things like record sharing with external providers or enhancing our referral process so that we can get patients to that higher level of care as needed.
Great, that's helpful to know. And if last question of the conversation, when you think about advice that you might give, so say you were talking to employers who are considering benefit decisions for their employee populations and are thinking about offering virtual care, what advice would you give those employers as they think about this?
Yeah, so I would say that the medical and mental health needs of individuals or employees are so varied. I would think that there would be very few cases where offering virtual visits would not lead to really high engagement amongst your population. There also have been certain assumptions, I think, about virtual care that over time have just been unproven. Ability for seniors, for example, to operate the technology, to be able to, access services or sign up for visits in advance. The ability for therapists to really achieve significant outcomes without that patient sitting in the room with you. These things have been disproven over and over again, as also evidenced by the fact that we're seeing really high patient satisfaction and engagement, like I just mentioned. What's really exciting for me is starting from the position that most individuals, most patients can be seen virtually. They may just need some more routing to the appropriate level of care for them. The innovation, the technology possibilities, I think, are endless when you start thinking about delivery of cognitive behavioral therapy, group visits, day treatment programs, primary care based mental health services, working with emergency rooms and doing consultations, using other digital or self service kinds of models, sending patients devices like breathing trainers to help them manage their panic symptoms. The possibilities, again, are endless. So it's a really exciting field to be in at this time, and something that we should all be leaning more into.
Well, thank you so much for your insights, Dr. Benders-Hadi. I've really appreciated hearing your perspective on virtual care and mental health care. And we are also very hopeful at Bind that these new and innovative models of care will address the existing and growing need for mental health care in particular. We're definitely working hard to include virtual behavioral health care and other digital solutions in this place, and looking forward to where the innovation continues to take us. Dr. Benders-Hadi, thank you again for sharing your expert insights on this topic, and thank you to everyone for listening. Be well and be safe.